Dr. Plovnick is the Director of the Department of Quality Improvement and Psychiatric Services at the American Psychiatric Association. He oversees preparation of APA psychiatric treatment guidelines, development and assessment of performance measures for psychiatric services. The American Psychiatric Association has more than 38,000 members. Welcome.
Thank you. Thank you, Madam Chairwoman. Members of the Small Business Committee, I'm Dr. Rob Plovnick, Director of the Department of Quality Improvement and Psychiatric Services, the American Psychiatric Association. It is an honor for the APA to present this testimony to the committee regarding unforeseen challenges at VHRs to small specialty practices. The APA represents more than 38,000 psychiatric physicians nationwide. Our members work within a variety of systems of care, including emergency departments, inpatient settings, and small private practices. The development of health information technology and corresponding federal and state laws and regulations are a matter of great interest and concern to the APA, our members, and their patients. The APA has one committee of members solely focused on various aspects of EHRs and a second committee solely focused on privacy and confidentiality concerns. Carefully structured, a national HIT infrastructure has great potential to improve the overall quality of care provided to patients, inform health professionals of the latest standards of care, and to improve communication of healthcare information across settings. However, there are two significant challenges to widespread adoption and implementation of EHR systems that the APA would like to highlight in our testimony today. First, the assurance of confidentiality is at the core of any effective patient-physician relationship. Electronic health information exchange could erode patient trust and impede clinical care if it facilitates dissemination of sensitive information without sufficient precautions to protect privacy and security. Second, a significant percentage of APA members operate in solo private practices in which the upfront costs of implementing an EHR system present a considerable barrier to adoption. Protecting and strengthening the confidentiality of the patient-physician relationship is critical to providing the highest quality medical care. This is particularly true with respect to psychiatric care because of ongoing inequity in insurance coverage, employment discrimination, and social stigma for people with mental illness. An unintended consequence of EHRs is that patients may be discouraged from seeking treatment or sharing information that is critical to their care due to concerns that it will be improperly disseminated. Treatment in behavioral health and other disciplines of medicine often requires patients to share sensitive information such as sexual history, drug use, pregnancy history, and HIV status. According to HHS, 2 million Americans, or 7% of those with mental illness, do not seek treatment specifically due to privacy concerns. A 2007 Harris Interactive poll found that 17% of patients withheld information from health professionals because of worries the information might be disclosed. These rates are likely to be even greater if information exchange is electronically enabled and the confidentiality and security of health information cannot be assured. The trust required for a productive therapeutic relationship is undermined by accounts of healthcare workers who view electronic records of celebrity patients, as well as by the loss or theft of laptops and CDs containing large quantities of health information. Apologizing and making improvements once data is lost is not a sufficient response. Privacy and security provisions must be keystones to the development of a nationally uniform HIT infrastructure. There are many approaches that could help protect the patient-physician relationship and optimize the advantages of the EHR environment. Examples include ensuring the strictest security protections and auditing are employed, and giving patients and clinician a degree of control as to who can access sensitive information. Despite the widespread recognition of the potential HIT holds to increase efficiency and quality healthcare delivery, system adoption rates remain low. A recent study in the New England Journal of Medicine found that only 4% of physicians had adopted fully functional EHRs, and those that had tended to be in larger practices. Consistently, cost is cited as the largest barrier to wider adoption. Although estimates vary widely, studies report the total cost for implementing office-based EHRs range from $25,000 to $45,000 per physician, and subsequent annual costs for maintaining the system range from $3,000 to $9,000 per physician per year. These expenditures are amplified for smaller practices where there are fewer physicians to share the costs. Psychiatrists involved in solo practice, a significant percentage of APA members, often have little or no administrative support staff, further increasing the physician's responsibilities with regards to selection, implementation, and maintenance of the system, and decreasing the time available for clinical care. The APA appreciates the effort the Small Business Committee has made to address confidentiality concerns while developing an HIT infrastructure, which offers a great potential to raise the overall quality of care provided to patients. This goal can be met without breaching privacy protections and can assure patient trust if privacy is made a cornerstone of HIT development. The APA further recommends the use of financial incentives such as grants or other support to help practitioners in solo or small group practices cover the costs of hardware and software. Again, we thank you for the opportunity to testify today, and we hope the members of the committee will consider the APA as a resource as this process continues.
Thank